Welcome. My name is Katie Henches, and I'm the Interim Director of Collaborative Programs and Initiatives at the Child Neurology Foundation. Today's talk is part of an ongoing series on emerging issues that children and families with neurologic conditions are experiencing as a result of COVID-19. These sessions bring together caregivers and healthcare professionals to have a candid conversation and provide their expert advice to the child neurology community. Today we're discussing PTSD impacting caregivers and medically fragile children during COVID-19 with Hilary Savoie and Kate Younger. Welcome, and thank you both for joining me today. We're so excited to hear your perspective.
Thank you. Thank you for having us. I'm Hilary Savoie. I'm a rare disease advocate, a writer, and the founder and director of the Acute Syndrome Foundation, which is a nonprofit focused on providing family support, funding research, and improving clinical care for those with SCN8A mutations. I'm also the mother of a really lovely and beautiful 9-year-old girl named Esme, who has multiple genetic mutations that have led to developmental epileptic encephalopathy and medical fragility.
And hi, I am Kate Younger. I am a clinical psychologist and associate professor of pediatrics at Cincinnati Children's. And I specialize in working with children who have difficult to control epilepsies, and many times they may also have different behavioral or developmental conditions as well. So Hilary, I would love to start this off first by just hearing what your experience has been like with PTSD.
Absolutely. My experience with PTSD is of the variety that people can get from witnessing medical trauma. So my daughter Esme had cardiorespiratory arrest when she was 3 months old. And I literally carried her in my arms through the doors of an ER with her turning blue. And this was a horribly traumatic experience, obviously. But it's one that's easy to kind of outline for people. They can imagine it, they can think of it like a scene in a movie. But I think over the 9 years of Esme's life, we've had a whole bunch of other experiences that were really traumatic as well. And that includes numerous seizures, respiratory emergencies. And many of these events happened when I was alone with her, often at home, or sometimes like driving down the highway, or in public places surrounded by strangers. And I guess I've sort of come to realize that these traumas and the experience of having them alone have been more insidious for me. And my experience of PTSD has included having pretty serious flashbacks occasionally. They were severe for a time, and they've gotten less severe as time has gone on, but they still occur with some regularity. And then, hypervigilance and nightmares and some avoidance symptoms as well. Mm-hmm. So, Kate, oh, I'm sorry. What?
That's really hard stuff.
Yeah, it is, and it's a challenge to talk about. And I think you and I connected because we both have personal experiences with PTSD, and I was hoping you could share a little bit about that.
Sure. So my personal experience is that my twin brother was in the Special Forces with the Army, and he actually died by suicide a little over 7 years ago. And we will never know for sure everything that kind of led him to that place, but given his experiences, it's reasonable to assume that trauma was part of what he was struggling with. And so, not only professionally as a psychologist, that I work a lot with kids and parents who have been traumatized in all different ways. Through my professional work, my family has also been involved in trying to help the veteran community and trying to help raise awareness for PTSD and help connect vets to resources that can help them.
I'm so sorry for your loss, and I think it's truly amazing that you've been able to use your experience to try to find ways to help others.
And I could say this for you. I think that we've both been in the position with dealing with really hard, unexpected things and a lot of stuff that we don't necessarily have control over. And, you know, one of the things is that in some ways it's a lot easier to avoid than it is to talk about this. But one thing that I think is so amazing about what you do is being willing at personal cost to yourself really to talk so much about your experience, because I really think you give voice to people who may not have the words for what it is that you've experienced. And, you know, people have said to me after listening to you or reading your work, like, I just never knew until I heard her say it, but that's me.
Well, that's incredibly touching to hear. And it is why I do this, although sometimes I feel like I don't necessarily have a choice. Like, it's just, you just kind of do it. And in some ways, I think we've talked about this in the past, but it's also a really good avoidance technique to sort of throw yourself into it in a way, because you develop an ability to screen yourself in certain respects, I suppose.
Intellectualize it.
Yes, exactly.
Mm-hmm.
And I think it's important that we've kind of jumped into this conversation about PTSD, and you've mentioned your experience with your brother, and I think most people associate PTSD with combat. But perhaps you could talk a little bit about what PTSD is and why and how it can be found in other settings in addition to with combat veterans.
Sure. Yeah, and I think you're exactly right. Kind of a lot of places our brains automatically go when we talk about PTSD is with our vet population, and it's a big issue that faces that population. But really, PTSD can develop in anyone after they've been exposed to a situation in which they felt like they might die, or the safety of someone close to them was threatened, or a situation in which they or someone they care about or around is experiencing even the threat of really serious physical injury. And so PTSD is actually a clinical term for post-traumatic stress disorder, and lots of people can have trauma symptoms that aren't PTSD, right? Like when you go through these really terrible and scary things, everybody is going to feel some distress, maybe, you know, mood changes or sleep changes, eating, kind of removing themselves, or it can look lots of different ways. But PTSD is really for the subset of people who develop symptoms that go on for at least a month and cause really significant disturbances in their life. And when I talk about PTSD symptoms, some of the things that people might notice, as you had mentioned, is reexperiencing. So feeling like you're back in the situation again, even if it's over, it's like it's happening again. A lot of people will talk about that, like in terms of flashbacks. People certainly can experience changes in their mood or thinking where it gets more negative, or, you know, it's hard to feel happy. You might have a hard time even imagining what the future can look like. It creates your body kind of being in hyper mode all the time, in that survival mode, which means things like being really jumpy, not being able to sit still. You might notice again, like it's really hard to sleep or really hard to concentrate, because when your body is in that fight or flight mode, your systems are just on overdrive a lot of the time, and our bodies aren't really developed to be that activated all the time. And then another hallmark symptom of trauma is wanting to avoid things that make you think about the event, people who make you think about the event, places, even your own thoughts and feelings related to what you've experienced. And so, sorry, I should follow up to say, in children with, or in parents with medically fragile children, we actually know that lots of parents experience trauma symptoms. And in fact, research shows that 10 to 20% of parents might actually meet clinical criteria for PTSD, and that another potentially 40% of parents experience some level of trauma symptoms related to their experience going through the health system, or just being there next to their child as they face these different challenges.
And I think this is something that's very, very, very interesting. And again, you and I have spent some time talking about the fact that parents who are raising children who have repeat medical trauma, you know, if you're actually having to repeat these experiences over and over and over again. So not only might you be re-experiencing them in your mind, you're actually re-experiencing them in the world, and you have to be prepared to do that, which is very challenging.
Yeah. When we've talked about how it feels helpful in some respect, that things happen really unpredictably when you have a medically fragile child. And especially, I mean, you and I are pretty familiar with seizures. And we know that one of the hardest parts about seizures is the non-contingency of them. So if there is a pattern, that's great to know what the pattern is, but for many, many kids, there just is no pattern, and they can happen out of nowhere, and they can be life-threatening. And so the ability to react really quickly to do something to save your child and keep them safe is really important. But there are many, many moments where our children are in danger, and if our bodies cannot calm down between those crisis events, it becomes very hard for us to manage for our, you know, physical functioning, for our emotional health, for our relationship health.
Yeah, absolutely. And we are obviously in a very particular moment in time right now, and I think, I imagine that a lot of people are experiencing things that are exacerbating PTSD symptoms, such as isolation. Could you talk a little bit about that?
Sure. Yeah, this is an incredibly challenging time that is filled with stress in so many different ways for so many different families, not least of which I think is the isolation and the physical separation that a lot of people are experiencing, both from their normal routines and their networks of supporters, those people who we rely on to help us. But I've also heard a lot of parents also talking about how hard it is to be separated from the healthcare system. So, you know, we rely on being able to be with our providers in a lot of ways, being able to talk to them, get reassurance, help when our kids are experiencing symptoms, or even, you know, things like speech and OT and PT, being able to work with our providers one-on-one. And it's been really unnerving to a lot of parents and very stressful to be disconnected from those people who are such an important and integral part of their family and their child's health. Yeah. This just particular time too, there are so many uncertainties. There's a lot of concern that we're exposed to all the time in terms of the news and social media and discussions that we're having. A lot of health-related discussions and discussions about really scary things that can happen when you get COVID, which can be incredibly triggering for anyone, but especially parents who have been through those medical crises with their children. Some people are noticing that the symptoms that they had before are getting worse. Yeah. And other people are experiencing this now for the first time. And there's also the potential with COVID, if you're around someone who gets really sick or frontline healthcare workers, they may be experiencing the traumatic event kind of right now during this time that can set off things that are really difficult for them.
Yes, absolutely.
So I'm curious, could you share some of your experience of what it's been like for you and Esme as you've kind of confronted COVID and quarantine and all the radical ways this has changed?
Yeah. I find that I've thought a lot about this in quarantine. In some ways, I think we're in the middle of an experiment that would otherwise be impossible, where literally everyone around me is getting a taste of what it feels like to have to be isolated in some of the ways that I've experienced as Esme's mom over the last 9 years. So that sort of that sense of isolation, the fear of other people's germs, and I think the little bit of a secret where, like, when you're in the middle of disaster almost striking at any moment, there's also a lot of boredom, right? Where you're just kind of sitting and waiting for something to happen. But it's also been isolating to me to watch people go through this, this thing that's by definition temporary, and by definition a very shared experience. So literally everyone is having this experience at the same time. Every third story on your news feed is telling you how to entertain yourself in isolation. And so it's been hard to see people struggle with such a limited experience after almost a decade of living that way pretty intensely. But I'm also find myself really well prepared for this as a result. Like I'm used to weighing the risk benefit health scenarios. This is absolutely not like the one and only devastating virus in our lives, right? This year alone, Esme was hospitalized for adenovirus. She also had flu B, and I'm really no more scared of COVID itself than I am of those things for her, because they, can be as dangerous. And on the flip side, while this is all very familiar, this is really the first time in Esme's life, this year, late last year, early this year, that she's been able to take part in life in a really more typical way. She's been stable. And so she's had just started going to school full time. She had just started taking the bus to school. And I feel like that door got slammed in her face. She'd been waiting. And this is the moment where she steps out into the world, and this is what happens. And regardless of how I would weigh those risks and benefits for her personally, and we're seeing as a result some pretty significant physical regression, social confusion, and anxiety, which is just really painful to see. And then I think you spoke a bit about that anxiety around access to normal healthcare. And that's been a huge concern with us as, I can handle a lot at home, but if Esme is experiencing something that I can't handle, we have to be able to quickly and effectively get to someone who can hands-on assess her, because if I can't figure it out at home, telemedicine is not going to figure it out. Right. She needs hands-on, she needs blood tests. And so with this regression that we've seen, we've really been struggling because she's had only telemedicine PT, and we couldn't get her in to see a doctor hands-on, an orthopedist, to assess whether there was a break or a dislocation that was causing the problem. Unfortunately, she finally did get seen, and we know that isn't what's causing the problem now, which leaves a neurological problem or regression from lack of therapy in a child who's probably never gone 3 weeks without therapy in her life, quite literally since she was 2 or 3 months old. And so that's really been a huge challenge, and I think an overlooked reality of people who are high healthcare consumers to begin with, that they need to be able to access high levels of healthcare. And that's really exacerbated a lot of my anxiety, I think. And it makes me feel very vulnerable, and it makes me feel that my child is very vulnerable and that we're quite isolated. So, I've been trying to figure out ways to cope with that. And I know we've talked a little bit about these things in the past and how to cope. And I was hoping maybe you would share with me and everyone else some tips on how they can better support themselves in this time.
Sure. Yeah, I'm happy to talk about that. Before I do that, I just want to reflect two things that you're saying that I think are so important is that so many parents talk about how isolating it has been since their child, presented with whatever medical issue that it may be, and that a lot of parents for months, years have been coping with these things in relative isolation, and that suddenly now the whole world is kind of shutting down and everyone has that sort of taste of it. Which, some parents have said to me that in some ways it's nice that people have some hint of what it's like so that they feel more validated in what they've been through, but it's also not what it's not what it's like. It's not for the same reasons, and the duration matters. So as you've said, Esme has worked her whole life super duper hard for all of these inch stones, right, that she has accomplished, and she has gotten so far. And it's so hard for her to not have access and to see those kind of inch stones maybe slip back during all of this, or to feel like there's an underlying thing that is not being caught or needs to be addressed. But I've also heard parents talk, as the world starts to open up, what happens if, we have to stay in isolation for longer, and what, you were here with me for a little while, and then what's going to happen when the world goes back to the world being the way it was.
Yeah, and I think those 2 points and the fact that they can kind of coexist are really important. That, like, on the one hand, you can be, as the world opens back up, it's like right now it's nice that I no longer have to explain to someone why they need to wash their hands before they touch my child, right? Like, we all know, yay, we've all figured out we can wash our hands. And that this was really, for me, it was sort of exciting to think about people being just more cognizant about what happens when you cough in your hands and then you touch a surface. And will people sustain that, and for how long? But then at the same time, this sense of needing things to be open and needing things to move forward, and that weighing that health benefit ratio, that risk benefit ratio is, it isn't just a matter of Esme's will be healthier if she isn't exposed to COVID. She's less healthy than she was in January because she's not getting therapy. And we could keep her in that bubble for the next year and maybe keep her not exposed to COVID. But what happens then to her physical development, and how do we weigh those things? Because her health is being risked now by being isolated. And I can measure it. I can put up a picture of her, my 8-year-old, right before her 9th birthday, 8-year-old child took her first steps. She was taking, 5 to 7 independent steps in January and February. And now she barely pulls to stand in a matter of not having therapy for several months. And that is a health issue.
Yeah, you're exactly right.
So,
yeah. So I think that, your point about weighing and trying to figure out what the best path forward for your family is really important. And one of the things to cope is to plan and not panic. So we live in a world right now that there is this virus going around, and it doesn't do any of us any good to kind of spin on that and stay stuck on it if it's not leading right in the moment to some different actions that we can take, or some plans that we know will actually kind of keep us and our families safer. So one of the things I would like to throw out there is have a plan for what would happen if someone in your family gets COVID, or, readjusting your plans as you decide what the best path is for your family, because you're the expert on your family. Kind of where you are in terms of your boundaries and what you want to do. And so having conversations and talking about that and being willing to kind of revisit where you're pushing those boundaries over time can be really helpful. In general, kind of coping with any strong emotions, I rely on 4 kind of sets of things that I think through. So one is distraction can be a really powerful tool, and not in the avoidance sort of way that leads us from really dealing with and kind of digesting the difficult things that we've been through, but as a way for us to kind of mindfully recognize that we might be struggling and shift our attention to something that gives us a mood boost, that gives us relief, that helps us get back to the present moment. Sometimes I think of depression as our brain going back into the past, kind of revisiting hard things that we can't change. And anxiety is oftentimes our brain shooting into the future, imagining bad things that will happen that we won't be able to deal with. For the most part, the present moment can feel okay most of the time. And so one thing is, if you can kind of bring your mind back to something really engaging in the present moment, that can give your mind and body a lot of relief. Another thing is relaxation. I cannot say that enough, that practicing relaxation and giving your body a chance to really kind of calm down your nervous system, which is a hallmark of anxiety and trauma, is really important. And really the best time to practice relaxation and get really good at it is when you're already calm. It's kind of like when you're riding a bike, you don't start at the top of a hill and just hope you pedal. By the time you get down there, you need to have the skills to use when you get in challenging situations, and it can be minute breaks. I mean, 5 minutes throughout the day, but that is a really important thing for your nervous system to have. Action is another big thing I talk about. So movement, our bodies and brains love movement. It helps us to release endorphins. It gives us strength. So that's a really good piece of it. And then paying attention to our thinking. So it is not that everything is sunshine and butterflies. It's not sunshine and butterflies. But we can also be aware of our thinking and take a step back and try to understand if our thinking is making things easier for us to deal with, if we're thinking kind of helpful ways about what's going on, or if our thinking is leading us down paths that make it more difficult to cope with what is going on. And so having checks on that is really important. I think sharing, and we've talked a lot about this, that we know that perceived social support is really powerful. And so I say perceived because while there may be many people around you who want to help, if they're not offering help in the way that feels good to you and helpful to you, they may want to give help, but it's not super helpful. So trying to figure out how you let people around you know what it is that you need is really great. And kind of finally, if you're really experiencing significant symptoms, if you are struggling, if you feel like you need help, please reach out to your own doctor. There are lots of psychologists and therapists who specialize in PTSD. There are medicines that you can take to help get relief. So if you really feel like you're struggling, I really recommend getting kind of connecting with a professional to see what we can do to help you.
I think that's fantastic advice and very much needed. And I'm also pleased to be able to say that I think my approach to dealing with quarantine in repainting all of my kitchen cabinets may have met all of your criteria for distraction, action, thinking, and relaxation. So thank you for the help.
Every time you look at them.
Thank you so much for talking with me today.
Thank you. I always enjoy talking to you.
Me too. I'm sure we'll talk again soon. Should we tell her? We can't hear you, Katie. You'll have to edit that. Sorry.
Yeah.
I kind of went like this because I figured.
I couldn't see you because I moved the thing over.
Oh, okay.
That's fine. I'm just going to pause and then start again, and they'll edit it in. Thank you both for joining us today and sharing your expertise with the child neurology community. For more resources and original Child Neurology Foundation programming to navigate care for children and families with neurologic conditions during COVID-19, check out our COVID-19 Resource Center at www.childneurologyfoundation.org/COVID-19. Together, we will get through this. Together, we are all child neurology.